them into a supine position, exposing the entire abdomen and draping the genitalia. Then inspect the abdomen. Assess the abdominal contour by standing to the person's right side and looking down. Then stoop or sit with your head slightly above the abdomen to gaze across it. Determine the profile from the rib margin to the pubic bone. The contour normally ranges from flat to rounded.
When we talked earlier, you mentioned that you had some trouble with some bloating. Are you lactose?
Be aware that lactose intolerance affects 70 to 90% of Asian, Black, Native American, and Mediterranean adults. It may cause abdominal bloating, pain, and flatulence if milk or milk products are consumed. To assess symmetry, shine a light across the person's abdomen. The abdomen should be symmetrical bilateral and display no bulges, masses, or asymmetry. To highlight any change, ask the person to take a deep breath or do a sit-up without using his hands. You should see no localized bulging.
Okay, you can relax now.
Next, inspect the umbilicus. Normally, it is midline and inverted, with no discoloration, inflammation, or hernia. Then inspect the skin. It should have a smooth, even surface, with a homogeneous color, and no rashes or lesions. Veins should not be visible, unless the person is thin. Note any surgical scars. Also observe for pulsations or movement in the abdomen. You may see respiratory movement. In a thin person, you may also see aortic pulsations in the epigastric area. To auscultate the abdomen, begin with bowel sound.
How close is your stomach in?
After warming the diaphragm of the stethoscope, hold it lightly against the skin. Start in the right lower quadrant over the ileocecal valve, because bowel sounds should always be present here. Note the character and frequency of bowel sounds, which typically are high-pitched, gurgling, cascading sounds that occur intermittently 5 to 30 times per minute. Do not count the bowel sounds, but determine if they are normal, hypoactive, or hyperactive. Normally, they sound like this. Hyperactive vowel sounds are loud, continuous, high-pitched, rushing, and tinkling sounds that signal increased motility. They sound like this. Hypoactive vowel sounds are diminished or absent and occur after abdominal surgery or with peritoneal inflammation. They sound like this. Next, auscultate for vascular sounds, or bruit. Using firmer pressure, listen over the aorta, renal arteries, iliac arteries, and femoral arteries. You should hear no vascular sounds. If present, a bruit sounds like this. After warming your hands, use percussion to assess all 4 quadrants. As you do, note areas of tympany, indicating gas, and areas of dullness, indicating fluid, adipose tissue, or feces. Normally, tympany predominates. A large area of dullness may suggest an enlarged organ or mass. Now measure the liver span through percussion down the right midclavicular line. Begin over the lungs and percuss down the intercostal spaces until the sound changes from resonance to dullness. Mark the spot, which is usually in the fifth intercostal space. Then percuss up the mid-clavicular line, beginning over the abdomen. Note where the sound changes from timpani to dullness. Mark this spot, which is normally at the right costal margin. Measure the distance between the two marks. Typically, it ranges from 6 to 12 centimeters.
Okay, you're gonna feel me scratch your belly now.
If the person has abdominal distension or tense abdominal muscles, use the scratch test to check the liver span. Place the stethoscope over the liver. With one finger, scratch in short strokes over the abdomen, from the right lower quadrant up toward the liver. When the scratching sounds louder, you've reached the liver's border.
I'm going to examine your spleen now.
Next, assess the spleen by percussing down the left mid-axillary line. If stomach tympani doesn't obscure the spleen, you should hear splenic dullness from the 9th to 11th intercostal spaces. Now percuss in the lowest intercostal space, in the left anterior axillary line. You should hear tympani.
Now take a deep breath.
Percuss again while the person takes a deep breath. Tympani should remain through full inspiration, showing a lack of splenic enlargement.
Okay, I'm gonna have this sit up now.
To assess the kidneys, use indirect fist percussion.
I'm going to tap on your back. Let me know if you feel any tenderness.
Okay. For this assessment, place one hand over the 12th rib at the costovertebral angle,
Does that hurt?
and thump it with the ulnar edge of your other fist. The person should feel a thud, but no pain.
Okay, just lie back.
Before palpating the abdomen, promote muscle relaxation, bending the person's knees and helping him relax.
In through your nose, and out.
Then, with warm hands, begin light palpation in each quadrant, keeping your hand low and parallel to the abdomen. With your fingers close together, lightly press in about 1 centimeter. Make gentle rotary motions, sliding the fingers and skin together. Then lift the fingers and move clockwise to the next location. You may feel voluntary muscle guarding, but you should not detect rigidity, masses, or tenderness. Next, palpate deeply in all quadrants. Use the same technique you use for light palpation, but press in about 5 to 8 centimeters. If the person has a very large or obese abdomen, use bimanual palpation. Place one hand on top of the other. Then push with the top hand and palpate with the relaxed bottom hand. To make sense of what you're palpating, try to visualize the structures under each quadrant. Also, don't mistake a mass for a normally palpable structure, such as the xiphoid process, liver edge, lower pole of the right kidney, aorta, rectus muscle edges, sacral promontory, cecum, sigmoid colon, pregnant uterus, or full bladder. As you palpate, note the location, size, consistency, and mobility of any palpable organ. Also note any abnormal enlargement, tenderness, or masses. Mild tenderness is normal when palpating the sigmoid colon.
I'm going to palpate your liver now.
Now palpate for the liver. To support the abdominal contents, place your left hand under the person's 11th and 12th ribs and lift up. With your fingers parallel to the midline, place your right hand on his right upper quadrant. Push down deeply and under the right costal margin.
Take a deep breath.
Ask the person to take a deep breath as you palpate. If the liver is palpable, its firm, smooth edge should bump your fingertips during inhalation. As an alternative, you can palpate the liver with the hooking technique. While standing at the person's shoulder and facing his feet, hook your fingers over the costal margin. As he takes a deep breath, Feel for the liver edge to bump against your fingertips. In older adults, the abdominal wall is thinner and softer than in younger adults, making organs easier to palpate. In these people, you may feel the liver edge at or just below the costal margin. To palpate for the spleen, reach your left hand over the abdomen and behind the left side, the 11th and 12th ribs. Lift up for support. With your fingers pointed toward the axis, place your right hand obliquely on the left upper quadrant, just below the rib margin. Push your hand deeply down and under the left costal margin. Then ask the person to take a deep breath. Normally, the spleen is not palpable. When enlarged, the spleen bumps your fingertips during inhalation.
I'm going to examine your spleen. Just roll towards me.
As an alternative, roll the person onto his right side to displace the spleen forward and down. Then palpate the spleen using the same basic technique.
Okay, good.
Next, palpate the kidneys. For the right kidney, put your hands in a duckbill position at the right flank. As you press your hands together firmly, ask the person to inhale deeply. In most people, you will feel no change, or you may feel the bottom of the right kidney as a round, smooth mass. For the left kidney, reach your left hand across the abdomen and behind the left flank for support. Then push your right hand deep into the abdomen and ask the person to breathe deeply. In adults, the left kidney should not be palpable. In young children, the edge of the kidneys, liver, and spleen are easily palpable.
I'm going to feel for your aortic.
To palpate the aorta, place your thumb and fingers on the upper abdomen, slightly left of midline, and palpate lightly. The aortic pulsation normally is 2.5 to 4 centimeters wide and pulsates anteriorly. If needed, perform 2 special procedures. For someone who reported abdominal pain or tenderness, check for rebound tenderness or Bloomberg's sign. Hold your hand perpendicular to the abdomen, away from the painful area. Push down slowly and deeply, then lift up quickly. Normally, this action causes no pain. If you elicit pain or rebound tenderness, Bloomberg's sign is present, indicating peritoneal inflammation.
Does that hurt me?
If liver palpation caused pain, check for inspiratory arrest or Murphy's sign. Hold your fingers under the liver border as the person inhales deeply. If he feels sharp pain and abruptly stops inhaling, he has Murphy's sign, which suggests an inflamed gallbladder.
Alright, your exam is normal. Do you have any questions for me?
After completing the abdominal examination, share your findings with the person and answer any questions he may have. Then use your findings as the basis for teaching him about self-care topics that can help maintain and promote his health. Thanks.
知道了。